Good morning to you. Good morning to everybody who makes possible this broadcast, to Gisela who supports us from the studio, and most importantly, to all people tuning in from different parts of Cuba and other parts of the world. Today, we have the good news that we do not have any fatalities, and in our hospitals, 146 patients remain admitted, 11 in surveillance, 93 are suspects, and confirmed active cases 42. In our primary healthcare system, our professionals and specialists follow 105 people. Yesterday, the island processed 2,273 samples for the diagnosis of COVID-19. In the IPK laboratory, 885. In the provincial center in Havana, 470. In Santiago de Cuba, 281. In Villa Claras, 191. At the Center for Genetic Biotechnology, 94. And at the laboratory of the Civil Defense, 64 samples. And the Almejiras Brothers Hospitals, 321 samples processed. As a result of the study of these samples, 7 patients tested positive for COVID-19 and SARS-CoV-2. 7 cases. And that totals 173,063 samples studied up to yesterday by our laboratories, out of which 2,348 people have tested positive in Cuba, which represents 1.4%. We always add for our population to be informed that not only samples were from Havana were studied, the largest number was in Havana with 1,662, but there were also samples processed from other provinces, 46 from Pinar del Rio, 55 from Mayabeque, 61 from Villa Clara, 51 from Cienfuegos, 45 from Ciego de Ávila, 143 from Las Tunas, 104 from Granma, and so forth. All provinces processed samples, and this shows that a surveillance remains in all the provinces of the country, which we expect to be increased in upcoming days through some studies that will be increased in population groups, in some populations with certain risks, in some workplaces for certain complexities, where it is considered to perform and to conduct a surveillance, taking into account the high percentage of asymptomatic people that are carrying the virus who are spreading the disease. The 7 cases confirmed yesterday, all of them are Cuban, 6 are confirmed case contacts, and so 2,038 people in all of the pandemic in Cuba, that is 88.4% of all confirmed cases in Cuba, have been confirmed case contacts. This is a very important high risk group, and this leads us that every time that a case is confirmed, we conduct a contact tracing for the last 14 days, and all of the contacts are admitted and they are studied to verify if that person is infected or not with the disease. Of the 7 cases that were diagnosed yesterday, 1 has a source of infection abroad. And with this case, there is a cumulative of 163 persons who have been confirmed in Cuba, which is 7.1% of all cases, who have had a source of infection abroad, out of the country. They have come to the country and they've come infected. The source of infection has not been determined in 105 patients, and this is the 4.5% of all confirmed patients. I always explain that we always work to trace the contacts of the people who this person might have infected. 3 of the cases are male, and for a cumulative of 1,182, 50.3%, and the female sex prevailed with 4 cases. 1,166 confirmed cases of the female sex, which is 49.7%. The 7 cases were asymptomatic for a cumulative of 1,272 people, asymptomatic people since the beginning of the pandemic, accounting for 54.2% of all cases confirmed since the beginning of the pandemic in Cuba on March 11th, when we had the first cases reported. And this is the 54.2% have been asymptomatic at the moment of their diagnosis. Over the last 15 days, of the 72 cases that have been diagnosed, 55, which is 76.4%, were asymptomatic at the moment of the test. I always insist on these numbers to highlight the risk that is present because of the high number of asymptomatic cases that are carrying the virus and that can be spreading the disease. And that's why all the protection measures are justified. The use of the face masks, the hand washing, the isolation, the social distancing, and all these guidances that are established, and we have to we have to ratify them continuously. Of the 7 cases, 5 belong to the province of Havana. They are from the Cotorro municipality. 1 belongs to Mayabeque province from the municipality of San Jose de las Lajas. And people know that in both municipalities, work is being done to control an outbreak that has been reported in these 2 provinces, and all of the cases are related to one infection that took place as a result of the non-compliance with some regulations. The case that is imported, and we call imported because the case was actually infected out of the country. This is the person who arrives at the island and is coming already with some symptoms, or at least with certain risks of the disease. This case is from Las Tunas province. He is from the Puerto Padre municipality. This case is not included in the incidence of positive rate of the province, because actually the infection did not take place in the province, so it is not included in the rating of the province. This is a province which has spent over 15 days without reporting any positive case. So this case is not a result of a spread in that province. So Havana province remains with the highest positive rate in the last 15 days, although it decreases as compared to yesterday's. And now it currently has a positivity rate of 3.09 per 100,000 inhabitants. Mayabeque follows with a rate of 1.56 per 100,000 inhabitants, which it's higher than yesterday. And we ratified that 13 provinces of the country and the Isle of Youth Special Municipality continue without reporting cases of the disease over the last 15 days. By age groups, 5 of the 7 cases were under 20 years of age. We're talking about 4 children, 2 males and 2 female from El Cotorro municipality, all confirmed case contacts, and a girl from San Jose de las Lajas municipality in Mayabeque that is also a confirmed case contact. So for a cumulative of 261 children and adolescents confirmed in Cuba with COVID-19. out of which 250, that is 95.8%, have already recovered and are discharged. They've all had a favorable clinical evolution and they've had a satisfactory evolution in all cases. And there are two cases in the group from 40 to 59 years of age. Of the 2,348 diagnosed in Cuba with the disease, 42 remains admitted. The active cases, this is 1.8% of all confirmed cases. 41 of the 42 patients, that is 97.3%, they have a favorable clinical evolution, and there is one patient remains in serious condition. We had reported about her yesterday, and she is admitted at the Dr. Luis Diaz Soto Military Hospital here in Havana. We always regret the death of 86 people who have died in our country during the evolution of the pandemic. This gives Cuba a lethality of 3.66%, which is lower than yesterday, and Cuba remains with this lethality at the 19th place in the region among all the countries that make up the region of the Americas with confirmed cases. So Cuba has the 19th position with 18 countries with higher confirmed cases, more confirmed cases, and higher lethality. And the island remains on the 99th place in the list of countries of the world reporting cases of COVID-19. And here we have a chart that we would like to show to all the population with respect to the behavior of the lethality in Cuba. This is an evolution that we have tracked following the month. What you see in red is the cases that have been confirmed in each particular month. Since we began diagnosing cases, we are talking about the month of March, as you can see there. So the moment that we had the largest number of confirmed cases was in April, when we had 1,325 confirmed cases. Afterwards, it was the month of May with 546 cases. And then in June, the number have been lowered, and then we had in June 249 cases. Likewise, the number of fatalities have decreased. I would like the chart to be shown. That's right. Yeah. The lethality that from 1.4% that we had in April, the lethality from a 4.4% that we had in April, now it came down to 4.5. So the lethality from a 4.4% that we had in April, it came down to 3.5% in May and to 1.2% in June. So we have noticed a decrease. We managed to have this chart designed with the help of Professor Jose Raul, and so it helped us trace the lethality. This data is a result. You can just some people contend that the virus is changing, that it is less aggressive. We don't have any evidence proving that this is the cause of the current situation. We think that the early diagnosis, you have to notice the high number of people who have been diagnosed even being asymptomatic. So that means that we are identifying the patients at an early stage. And the treatment that is applied to the patients from the very moment that they are identified, that from the very moment that they are contacts or they are suspects, that they begin to be admitted, being provided with certain treatments. And many of these medications that are used in these treatments are a result of Cuban science. And some of the protocols that are used in our country with the patients who have some clinical complications, and they are treated with Cuban medications such as interferon, eberferon, the CIGB 125. So the different treatments are being applied. The treatment with convalescent plasma serum, which is also administered to patients who are in serious and critical condition. So this has allowed the decrease of deaths as a result of this disease. So, this is what has actually led us to the current result. Yesterday, we always mentioned the two persons that were evacuated at the beginning of the pandemic. And yesterday, 4 people were discharged. We didn't manage to get a favorable ratio, a positive ratio from the point of view that to have more, from the point of view of having more discharges than confirmed cases. So yesterday there were 4 discharges. The 4 discharges are from Havana for a cumulative of 2,218 patients who have recovered, and from the epidemiological or clinical point of view, which is the 94.5% of all the patients diagnosed in the disease with the disease in Cuba. And as we said, of all active cases, there is 1 patient who is in critical condition at the Dr. Luis Diaz Soto Hospital. The world remains with its complexities. All the news reports that show that in the 185 countries that are currently reporting COVID-19 cases, the number is of 10,273,000. One confirmed case only yesterday. Yesterday, 160,247 cases were confirmed in the world, and that leads to 10,273,001 confirmed cases. And yesterday, as a result of this disease, 3,773 people died in the world due to this disease, for a cumulative of more than 500,000. 505,562 people who have died in the world as a result of the disease. This represents a lethality of 5.92%. The region of the Americas already reports a very high number of cases. It remains as the center of the epicenter of the pandemic in the world. The countries of the region leads the world in terms of confirmed cases and fatalities. The United States and Brazil leads the list, and the region reports a cumulative total of 5,226,063 confirmed cases. After diagnosing yesterday 89,483 patients, that is, it already accounts for 50.87% of all cases reported in the world are from this region. With the 2,164 fatalities in the region had yesterday, for a cumulative of 248,672 deaths, for a lethality of 4.76% for the region. This is all the information we had for today in terms of the national and international situation.